Okay, so here I'm getting water. Next, I'm measuring out 3 scoops of powder and leveling it with the spatula and then dumping it into the green mixing bowl. So next you want to take the alginate, the 3 scoops that you already have in a bowl, and then pour the pre-measured water into the bowl and begin to mix by pushing the alginate up against the bowl, and continue mixing until the water and alginate are in a smooth mixture, kind of like if you're baking brownies, like you want the mixture to be smooth and there's no clumps or no dry spots. After mixing, you'll grab the maxillary tray and load the material by scooping it down the back side of the tray and then spreading it out with the spatula. Next, you would place the tray in the patient's mouth and make sure to push up on the back of the tray, and also make sure that the little handle is in the center of the mouth. After the tray is set to remove it, you'll hold the handle of the tray with one hand and stick one of your fingers in the patient's mouth and roll down to release the suction of the tray.
We are going to start by measuring out water to the second line. After that, we are going to measure out 2 scoops of alginate after we fluff it, and we're going to make sure to level it off with the spatula as we pick it up. After we put both scoops of alginate into the bowl, we're going to make an area in the middle so we can pour the water in and then begin to mix. You want to mix so it is a nice homogeneous mixture, which means it's all together like brownie mix. After you are done mixing, you're going to load it onto the tray, and you're going to load half of the material on one side of the tray and then the other half onto the other side, and you're just going to want to spread it out and make sure it's evenly dispersed throughout the tray to get a good even impression, and then you can use your fingers with a little bit of water to smooth out the top of the tray. To put it in the patient's mouth now, and you want to pull the lip to the side and rotate the tray in to keep them comfortable. You're going to seat it from the back first and make sure the midline is lined up, and then you're going to keep your hand on the tray so that way the patient knows that you're there for them. You never want to walk away from the patient during this procedure. And you're just going to keep an eye on your mixture, and once it is dry, you can remove it from the mouth. Once the impression material is dry to the touch, you're going to use your fingers in a rolling motion inside the mouth to break the seal. This keeps the patient comfortable, and it also allows for you to remove it easily. And then, there you go, you have your impression.